Hello and welcome. I'm Dr. Jim Lewis, founder of the Brain Injury Education Project. We're here today to look at an overview of the concept of neurotrauma informed services, which some regard as the cutting edge of behavioral health care. Behavioral health care meaning work with both alcohol and substance use disorders. This video is about two under-identified brain injury populations. First, child abuse and neglect and women experiencing domestic violence and substance use disorders. What do they have in common? Well, they've been a focus in the past in this widespread national movement called the Trauma Informed movement. It started in the 1980s, and we're going to cover more of that in a few minutes, the origin of the Trauma Informed movement, which focuses on psychological trauma. But these two populations, kids with child abuse neglect and women experiencing domestic violence and substance use disorders, have two characteristics. Both of them have a very high incidence of neurotraumas, as much as 90 to 95%, but extremely low rates of initial identification of only 1 or 2%. We'll see why that is because people aren't thinking about direct brain injury as being part of their symptom issues. It's attributed unintentionally to purely psychological trauma. So how did this trauma-informed model come about? Well, in 1980, Dr. Vince Felitti, who was a medical doctor, he was the founder and the first chief department head of the Department of Preventive Medicine at the Kaiser Permanente organization in Southern California. And they were looking at this concept of preventative medicine, that if you could identify conditions that were related in later life to more serious conditions, including fatal ones, heart attack, diabetes, stroke, and heart disease, so forth, that identifying these earlier in life, you treat the underlying issue, and then you don't end up with these long-term chronic medical problems. And so he started an obesity clinic. There were people who came there simply to lose 20 or 30 pounds, but there were others who had morbid obesity. You know, people who weighed 400, 500, 600 pounds who needed to lose 100 to 300 pounds or more. And in 1985, so after 5 years of data, Dr. Felitti looked at the data and he thought, what the heck is happening here? These people are completing their weight loss goals, but it had more than a 50% dropout rate. So clearly he thought there's something missing. And he didn't think that it was some little puzzle part, it's some big piece of the puzzle that was missing. So he set about trying to figure out what that was. And he started just verbally interviewing people, looking at medical records. You know, most of these folks were born with normal weights, even in early childhood, normal weights. He would ask things about at what age they were when certain things happened and so forth. And he made a clinical interview error. He ended up asking this young woman, how much did you weigh the first time you had sex? He meant to say, how old are you? But he said, how much did you weigh the first time you had a sexual encounter? And some seconds passed by, and according to his story, this young woman got teary-eyed and she said, I weighed 40 pounds and I was 4 years old and it was my father. Well, that was a big shock to Dr. Felitti. He hadn't been thinking about anything like that. And he started asking other patients. He got his colleagues involved. Eventually, the Center for Disease Control got involved. And they started to realize that childhood sexual abuse and adult life sexual assault were huge predictors of serious problems with obesity. But they also came up with a total of 10 items, not just about sexual abuse, 10 items, which is now called the ACE, Adverse Childhood Experiences Questionnaire. And this ACE questionnaire addresses just yes or no, did you have any of these 10 things in your life? And so that morphed into the trauma-informed model that's now expected of most healthcare, social services, child welfare organizations in the United States. There was a role for the brain in this model. It wasn't just all psychological trauma. The idea was that people exposed to pronounced or long-term chronic psychological distress with post-traumatic stress disorder, that they ended up having neurochemical changes in the brain. And this idea was applied to understanding some of these two populations. However, there was still something incredible missing. Now, what I'm about to tell you, I started some years before Dr. Felitti started publishing, so I didn't know about what he was doing. He certainly didn't know about what I was doing. And so what was that? The reality of direct cerebral trauma. So in the late 1970s, this brain injury education project was always on my mind. I was in clinical practice in my birthplace of Washington, D.C., Maryland, and seeing kids and adults from the surrounding 5 mid-Atlantic states. So from 1977 until 2019, initially working only in DC and the mid-Atlantic states, but in 2013 up until now, working in Florida, where I'm broadcasting here from St. Petersburg. And the same patterns emerged no matter where I was seeing these kids. But in addition to seeing over 6,000 kids during that period of time, I also saw their parents, more their moms than their dads. And I was observing that in these 3,000 plus women I was examining with neuropsychological testing to assess the results of brain injury and then clinical interview for psychological trauma, but direct measures of their brain dysfunction, attention, concentration, short and long-term memory, things like that, that they had significant impairments. And these were from domestic violence and substance use disorders. So what did I find in these thousands of children and adult women? So I'm going to talk to you about the kids first. So yes, I felt with certainty that the adverse childhood experiences, the trauma-informed model, was correct in that they definitely had PTSD, they definitely had psychological trauma. I mean, if you have physical, sexual, emotional abuse, neglect, one or two of the above or all of the above, you're certainly going to have psychological trauma. So there's no way that they were wrong about that. But abused and neglected kids from all these different jurisdictions, so I think it's a national issue. I don't think it's peculiar to where I worked. And I taught in the National Model Family Court program, so I was able to communicate with people from other states, that these 5 patterns of brain injury emerged in kids who either are not in the child welfare system, but ultimately become part of the child welfare system. And it was 3 H's: head injury, hypoxia, which is oxygen deprivation to the brain, hyperthermia or heat stroke, hot cars and so forth, hot bedrooms, failure to thrive, malnutrition of infancy and toddler of ages mostly, and then fetal prenatal drug exposure. I'm referring to this just briefly here, but at the end of this video, I'm going to give you a reference to a 3 credit course that is accredited nationally and locally in Florida. So having this information, what made me step it up to try to affect public policy, at least in the state of Florida? Well, 2 boys died. The one was named Baby Will Hendrickson, and the other one was Jordan. And when they died, we wanted to get a law, but it didn't pass the first year. I was upset that it didn't pass. It really kind of died in committee. It had been passing through the state of Florida House of Representatives, the State House, and the State Senate. It just got to a committee and it didn't proceed. So I approached the Tampa Bay Times. Why I approached that newspaper wasn't just because I live in that area, but it's the largest circulation print and online paper in the state of Florida, more so than the Miami Herald, Orlando Sentinel, bigger cities, but still the Tampa Bay Times was huge. I sent this as a blind submission. It wasn't an invited submission. Most of them don't even get looked at, but the editor responded to the submission literally in less than 24 hours and say they were going to publish Death by Ignorance, What Really Killed Baby Jordan and Baby Will. The ignorance, and by the way, that word ignorance isn't a bad thing. Ignorance means you just simply don't know something. And the ignorance was ignorance of the idea of brain injury being present. So Will died in July of 2017 from hyperthermia in his father's mobile home. Jordan died 1 year later from significant head injuries that were inflicted by his mother. He was only about 25 to 26 months old at the time. He had been in this beautiful foster home, 2-parent foster home, for most of his young life. He was returned to his mother at the end of May, beginning of June of 2018, and 90 days later, he was dead. And it made national news. Both of these cases made national news because the kids were all receiving, both of these kids were receiving services from agencies that were supposed to protect them, Child Protective Investigative Services and different Department of Children and Families, child welfare agencies. The thing that was in common, other than the fact that both of these boys had brain injuries of different types, none of the involved professionals had any significant brain injury education. So before I leave this slide, I want to mention something that I think is crucial. Even though this happened in Florida, these kind of tragedies were happening, are still happening in any state that doesn't have mandatory brain injury education. So what did we do? I found out that there was a local state house representative on the Gulf Coast of Florida, Pinellas County to be exact, and Representative Chris Latvala, wonderful man. He was very persistent. This really got to him, what happened. These boys died in his jurisdiction, and he developed something called Jordan's Law. I was connected to him by a victim advocate from the Largo Police Department, and she said, you got to meet Chris. So I met him, and I convinced him, it didn't take much convincing actually, that a crucial part of the law had to be mandatory brain injury education. There's other parts to Jordan's Law. You can read it on your own. I'll look at the course I'm going to give you a reference to. But he felt that the cornerstone, he called it, of Jordan's Law was this mandatory brain injury education for all child welfare professionals. At the bottom of this slide, you see who's all child welfare professionals, everybody that work with them, not just the initial investigators and the case managers, but the attorneys who represented the kids and the child welfare agencies in court, the judges who heard these cases in dependency and family court, the guardian ad litem professionals, law enforcement, and others. But even though this was incredible that when the law was passed, it made Florida the first state in the union to have mandatory brain injury education for all child welfare professionals, I felt there was still something missing. And what was that? Their moms. This addressed the kids. It didn't address the moms. Remember, I told you I saw between 3,000 and 4,000 mothers over a period of 4 decades. A lot of these moms had both domestic violence and substance use disorders, sometimes one or the other, more than likely both. These women appear in virtually every state in criminal courts, civil and domestic courts. Their domestic violence is known, but this idea of there's underlying brain injuries that are not identified wasn't being recognized in most states. I'll give you some exceptions in a second. But the national stats on this are pretty similar to what I was finding when I kept track of how often this was occurring. 90 to 95%, it might even be higher, some people think it's higher, of how often certain types of brain injuries were occurring with abused women, but only identified 1 or 2% of the time by therapists, domestic violence advocates and so forth. Not because they're bad people, but because this training hasn't gotten out, this idea hasn't gotten out. And it was a similar statistics for substance use disorders. So it was 2 specific forms of brain injury. Remember, I said there were 5 forms of brain injury with abused kids. There's 2 that appear over and over and over again with women who experience domestic violence or substance use disorders. One is repetitive concussion. Please note that concussion is a word. It really is traumatic brain injury. It's called mild TBI. It was identified with professional athletes starting at the beginning of this century. Now it's become part of a concussion protocol in virtually all levels, not just professional athletics, not just football, hockey, and so forth, but down into college, middle school, elementary, high school, for both male and female athletes. So it's a serious problem, but it hasn't been discussed so much in domestic violence and substance use disorders. And the second neurotrauma was hypoxia, disruption of the brain's oxygen supply. However, they're occurring for different reasons in domestic violence and substance disorders. So let's look at domestic violence, DV, first. It's inflicted. It's inflicted by punching, slapping, hitting, smashing a woman in the face or head with a fist or a hard object, or pushing them where the head strikes a wall or down onto a floor, or pushed downstairs or outside onto a sidewalk or street pavement. So inflicted concussion. Hypoxia in domestic violence is also inflicted, usually from strangling, from affecting the jugular vein and the carotid arteries around the neck, but also from smothering and sometimes deliberately drowning, all inflicted. In substance disorders, these things are accidental. So somebody getting intoxicated under the influence of drugs or alcohol, motor skills are affected, coordination is affected, judgment is affected, impulse control is affected, and they have a dramatically increased frequency of concussion from fights, falls, and different types of vehicle accidents. The type of hypoxia that is occurring in substance disorder is also not inflicted like domestic violence, it's accidental, and it's from incredibly dangerous overdose events. In the United States today, there's multiple studies, University of Arizona and others have looked at this. Hypoxia from cardiac arrest is the #1 cause drug abuse, not hospitals. So outside of hospitals, you have a national epidemic of this problem, cardiac arrest occurring, respiratory depression and so forth, occurring from substance overdose. Makes sense that these things would happen in hospitals because people are there for heart surgeries and other things. But outside of hospitals, epidemics of cardiac and respiratory arrest from substance disorders. And so we felt like this had to be, we had to put this in action. We had to take this conceptual idea of neurotrauma informed services and apply it to an actual population. So we applied for and received a grant in October of 2020 from the Bureau of Justice Assistance. It's a 3-year grant. It goes from October 1st, 2020 to September 30, 2023. It was targeted through women in the Pasco County Adult Drug Court in Florida on the Gulf Coast. Pinellas and Pasco County are both part of the 6th Judicial Circuit. It's a wonderful judge in Pasco County, Judge Sean Crane, who founded that drug court in the early part of this century. And we do some very specific things, directly assessing reading and impaired brain function in these women, but also very detailed, structured clinical interviews about their histories of concussion and hypoxia and domestic violence, and also concussion and hypoxia from substance use disorder and overdose events. But in order to make this program work, to make it effective in the women clients' lives, first you have to train the professionals. So all the professionals could attend webinars that we conducted to learn about these different types of neurotraumas and understand this concept. The court professionals, the attorneys, the incredible people at the West Care Foundation, which is a nationally recognized substance disorder treatment program, both inpatient, residential, and outpatient. And we have the opportunity, I have the opportunity to work with them here on Florida's West Coast. However, one of the other advances was all those years I spent in examining rooms, doing evaluations of women. I could speak to them directly after I did their testing. I could explain to them, here's what happened to you. Here's some things you can do, or some choices in your life that can diminish your future risk of having more brain impairment and your brain actually having a chance to heal. But in this program, I couldn't go talk to every single one of these clients. So we developed some individual client videos, which I'll tell you about in a second. So what can you do with all these ideas? How can you follow up? Well, the first thing is, here's the Jordan's Law course. It's fully accredited nationally. It's accredited by NAADAC, the National Association for Alcohol and Substance Abuse Counselors. And if you're in Florida, it's accredited through the Florida Certification Board. And for Florida attorneys, we sought and achieved an approval for credit for Florida attorneys, because the Florida bar uses a 50-minute hour instead of 60-minute hour. Attorneys in Florida, any attorney, not just ones working in domestic violence courts and so forth, any attorney in Florida gets 5 credits for this course. We applied for and received a separate Bureau of Justice Assistance grant through the St. Petersburg College Center for Public Safety Innovation, was partnered also as a co-sponsor with the Florida State Attorney General's Office. And there's a link to that course at the bottom. You have free access to that course. Once you complete the course and take the easy quizzes, you get a Zoom invite to a once-a-month, hour-long question and answer session that I conduct on Zoom. The other crucial follow-up is for the adult women. Now, this was for women in the drug court, but it has applications to any woman who's experienced domestic violence or substance disorder or both. There's the link, subscribe to this channel. You will have access to 3 videos, and there's going to be more. So when you subscribe, you'll have immediate knowledge of when the new videos go up. There's a 10-minute video for professionals telling you how to make the client videos more effective. And then there's a 17-minute video on domestic violence to show to the client. And there's a 14-minute video to show to the client on substance use disorders. Outside reading, Dr. Glenn Seaman, a neurologist at Barrow Neurologic Institute in 2012, started a clinic that focuses on women who have had domestic violence and their concussions and brain injuries, and the Ohio State University, who teamed up with the Ohio Domestic Violence Network. There's a link to them too. So I want to close by giving you some thank yous. First of all of you for looking at this and putting some of this in action in your own lives with the people that you work with, the clients and so forth. But thanks to the WestCare Foundation, the Florida 6th Circuit Court staff, the administrative staff, Judge Crane. Thanks to Laura Albright, who's the project media manager, and thanks to Lauren Dubendorf, who is the audiovisual support and editorial aid person for me. So I look forward to seeing you on some of these other videos. Take care.